Good
Ooh,
morning, folks.
got a full agenda. Still lots of people coming online, but we want to get started. Welcome, everybody. We're excited to have this meeting and share all the progress and all the work that we're doing together. My name is Heidi McPherson. If I don't happen to know you yet, co-lead alongside Dr. Srila Sharma, and we've got a very full agenda here. So we're doing our welcome right now, and we're going to start off with perspectives on the federal policy shifts as relates to our work. And then we're going to go into all the updates across the different work groups and the efforts of the Health Equity Collective broadly. We will hopefully reserve time at the end for community announcements. We always like to hear from you all of the upcoming events and resources, etc., that are helpful across the network and the community. So look forward to hearing from you all as we close out the meeting. And Sheila, anything you want to add before we move to the next thing? All right. Moving along. I'll pass it to you.
Thanks. Good morning, everyone. Srila Sharma with UT Health Houston, co-lead of the Health Equity Collective. It's so exciting to see everybody on the virtual screen here. Just want to take a moment to introduce our guest for this morning, Erica Hansen. She's a clinical instructor at the Center for Health Law and Policy Innovation at Harvard Law School. And her work focuses on several things related to whole person care, social determinants of health. And we've been working closely with her specifically around food as medicine related policy. And Erica has been very generous with her time and expertise as she actually we did 2 webinars with her this past year around food as medicine and reimbursement strategies. And we actually have those archived on YouTube if anybody's interested. But we invited Erica to speak with us just for a few minutes because we recognize there's a lot happening at the federal level in regards to policy shifts. And given their national expertise in this space, we invited Erica to just level set with us what is going on federally as it impacts social determinants of health and any recommendations, suggestions, or impacts that this could have. So with that, Erica, welcome, and I'll hand it over to you. Once you're done, I know you have to jump off at 9 Central, but maybe if you can stay on just for a few minutes and hop off at 9 as planned, we can have some time for any questions that folks may have. So with that, I'll hand it over to you. And Heidi has the slides, so she just tell her when you want her to move on to next.
Perfect. Yeah, thank you so much for having me, and definitely I'm happy to stay on until 9 for any questions that folks may have or discussion. Heidi, we can jump to the next slide. Perfect. Thank you. So today I hope to just touch on a few different topics that touch on your work and what's happening at the federal level. I know a lot of you are involved in federal advocacy. I've seen a lot of the great work that you're doing on the federal level. And so a lot of this may be a kind of review for some of you. But I wanted to touch on kind of transitions, what's happening with the new leadership and their new priorities, what's happening in Medicaid policy, Medicare policy, and then kind of the broader landscape, Congress and funding at the federal level. Next slide. Okay, so leadership updates in the areas that are kind of affecting a lot of the non-medical drivers of health work. Of course, at the Department of Health and Human Services, we have the new secretary, Robert F. Kennedy Jr. Kind of the most recent actions that we're watching are the reduction in the HHS workforce. We have the reorganization, most of which is happening with the creation of the Administration for a Healthy America, or AHA. And that is a lot of consolidation of the agencies that were in HHS. So a lot of this is happening with the president's budget and with the congressional budget. So we're watching to see kind of what happens with those agencies in the consolidation and making sure that what those agencies were doing is still going to be happening under this new AHA sub-agency and the other sub-agencies that are proposed to be created, and of course with the downsizing of the workforce. So a lot still up in the air there. We also have Dr. Mehmet Oz at the helm at the Centers for Medicare and Medicaid Services. The stated priorities for CMS have been cost transparency, elimination of fraud, waste, and abuse, and a focus on prevention, wellness, and chronic disease management. And we'll talk again a little bit more about what's happening at Medicare and Medicaid in terms of policy. And then finally, we have the Center for Medicare and Medicaid Innovation, or CMMI. Leadership there is Abe Sutton. The stated priorities are preventing disease through evidence-based practice, empowering people with information to make better decisions, and then driving choice and competition. On the 13th of May, Abe Sutton released a new strategy for CMMI that focuses on these stated priorities. And so I think there is a lot of potential there for the non-medical drivers. So we're going to have to kind of watch CMMI to see if there's anything to do. Also, we'll be watching the other cabinet confirmations that are still going on for those kind of lower down sub-agencies in each of these divisions. Next slide. Okay, so getting into the nitty-gritty here, talking about Medicare first, I believe, or are we on Medicaid?
It's Medicaid.
Yeah.
It's
All
Medicaid.
right.
Do you want me to flip to the Medicare
Nope,
side?
that's okay. Nope,
Okay.
we can talk about Medicaid first. Perfect. Okay, so kind of overall takeaways on the top of this slide. We are seeing a lot of continued enthusiasm for the non-medical drivers of health, for social determinants of health at the state level. So you all in Texas kind of had a big win last week or earlier this week. I'm losing track of time. In Maine, we had the state released a 1115 demonstration proposal that includes the full suite of nutrition supports and housing supports. Oklahoma enacted legislation 2 weeks ago to pay for nutrition supports under Medicaid. So we're still seeing a lot of desire and enthusiasm at the state level for these policies in Medicaid. The desire at the federal level is really to let states determine their own approach. So we've seen, and we'll go into this a little bit more, the rollback of guidance and budgetary flexibilities that were released under the Biden administration. And we have not seen new guidance released under this administration to show us what direction this federal government, this federal administration is going in. So we need to watch some of the pending proposals to gain insight into CMS's approach. So there are currently 6 1115 demonstrations to cover health-related social needs pending in front of this CMS. And so we need to watch those approvals to see what's going to happen. The ones that we're particularly watching are DC, Nevada, and Rhode Island to see what CMS is going to do. We'll also see if CMS releases new guidance. So here I've highlighted kind of the biggest rescissions and policy directives that we've seen out of this new administration since January. So on March 4th, CMS rescinded some guidance documents from 2023 and 2024 that really laid out coverage pathways for covering health-related social needs, so housing supports and nutrition supports under Medicaid and the Children's Health Insurance Program, or CHIP. But it's really important to note that CMS was not rescinding already approved state coverage, and it made clear that it's going to consider states' applications to cover these services and supports on a case-by-case basis going forward. So this is really signaling that CMS remains open to receiving new proposals. Another thing that's really important to make clear is that the policy pathways described in that rescinded guidance, so things like 1115 demonstrations and in lieu of services, which I know is important in Texas right now, are established by law. And so those remain unchanged. However, the rescinded guidance documents provided important details regarding the application of those policy pathways to nutrition and housing supports. So like the scope of coverable services, the ability to extend coverage to the household in certain circumstances, and the fiscal limitations of these pathways. Another thing that's really important is the rescission document on March 4th did not purport to rescind some other coverage documents. So things like the Trump administration released a comprehensive social determinants of health guidance in 2021. That guidance still stands, so that's really important. There was some in lieu of services guidance that was released in 2023. That guidance still stands. So overall, the administration said that they are going to continue to consider proposals for coverage on a case-by-case basis. And like I said, we're going to have to watch those proposals that are still pending. States are still releasing proposals, passing legislation. There's still a lot of activity at the state level, but it's kind of a wait and see at the federal level. Finally, on Medicaid, on April 10th, CMS issued updated guidance saying that the agency does not plan to approve any new proposals for these funding mechanisms called designated state health programs and designated state investment programs, and that it will not renew any proposals that have already been approved. So it's not rescinding those approvals, but it's not going to renew them. CMS issued this same policy change after the change of administration in 2017. So it's really kind of just reinstating that policy from 2017. These are funding mechanisms that allow states to draw down those federal matching funds for existing state programs that are outside of the Medicaid program. And it allows states to take those funds to help pay for their state share in 1115 demonstrations. So a little bit of a complicated kind of funding mechanism. Importantly, this policy change does not affect a state's ability to propose or gain approval for health-related social needs initiatives under an 1115 authority, but it does kind of foreclose some flexibility that states have to fund their portion of financing required for an 1115 demonstration, meaning that it is going to be more challenging for states to fund health-related social needs initiatives and other 1115 waiver initiatives. So I think there's been a lot of confusion over some of these policies, and hopefully this clears it up a little bit about what these did and did not do. Okay, we can move on to Medicare, and I'm happy to answer questions about these. So in Medicare, the kind of big takeaways here is that there have been proposed rollbacks of social determinants of health screening in the Medicare program. There's still a clear interest in nutrition and health in Medicare, but there's potentially a stronger delineation of strategy between food security and nutrition security. So like really trying to differentiate between food and nutrition security. And there's been a desire from the federal government for stakeholder input in determining that approach. So kind of similar to Medicaid, in the Medicare program, the federal government, CMS, is still trying to figure out what they want to do in this space. Again, there's two policies that I want to highlight. So one is the final rule to update Medicare Advantage, Medicare Part D, and the PACE program. So this is a final rule. It was released during the Biden administration and then finalized during the Trump administration. It does not go forward or finalize a proposal under the Biden administration to provide Part D coverage of anti-obesity medications. So that is just notable that the Biden administration proposed this. The Trump administration did not finalize that proposal. It establishes a list of non-allowable special supplemental benefits for the chronically ill. So this is a coverage pathway where a lot of non-medical drivers of health services are allowed to be covered for the Medicare Advantage population. So things like food and produce, things like home modifications, this is where the vast majority of those services are allowed to be provided in Medicare Advantage. This rule established a list of things that are not allowed to be provided under that program. Notably, that list included non-healthy food, right? So the Medicare Advantage program is going to have to adjust and see how do we change what we are doing in Medicare Advantage to make sure that we're only providing healthy food. And that is a big change for them. And so, this is where we provide the most food as medicine services in Medicare. And so there's going to be big changes there. It might look more like the Medicaid program. Finally, we have a new proposed rule. Comments on this proposed rule are due June 10th. This is an annual rule that updates payment rates for inpatient hospitals and quality measurement and the interoperability of our programs in Medicare. This is kind of a big proposal. It proposes to remove the screening and screen positive rate for the social drivers of health for our hospital inpatient quality reporting program and then our exempt cancer hospital quality reporting. So this is our inpatient hospitals. They're required to screen for the social drivers of health. This proposal is saying we want to scrap that. But at the same time, it's requesting comment on whether we should keep some screening or implement some screening on well-being and nutrition. So a very interesting proposal there from CMS. And it would also remove SDOH data collection and reporting from other programs across Medicare. Finally, there's a separate request for information on reducing administrative burden across the Medicare program. So there's some possibility there for flexibility on the SSBCI program where we deliver a lot of our non-medical drivers of health or any other issues that you all may be advocating on in this group as it pertains to Medicare. And then next slide. Finally, there's a lot going on in the broader landscape. Budget reconciliation legislation continues to be the main focus in DC. So on May 22nd, the House passed a budget reconciliation bill to extend tax cuts that are paid for through reductions in federal spending, among other priorities, two of the most notable and frankly lengthy markups were those focusing on Medicaid and SNAP. So on Medicaid, the Republicans in the House are proposing large changes to the program that are about 715 billion in federal savings or cuts. And so it would be about 8.6 million more uninsured individuals, according to the Congressional Budget Office. So this includes things like federal Medicaid work requirements, a moratorium on provider taxes, which is a way that states finance their Medicaid share. It ends the FMAP, or the matching rates available to states that expand Medicaid. And it also includes a provision that adds the budget neutrality requirement for 1115 demonstrations into statute. That's actually never been statutory. It was just a policy provision. And then on SNAP, the House cuts the program over 300, billion dollars. The proposal specifically requires states to pay a part of SNAP benefits based on payment error rate. It expands federal SNAP work requirements, and it actually gets rid of the SNAP Ed program. And then there's other things. It also adds about 60 billion in new spending for some farm bill programs, such as the commodity programs and crop insurance. So what happens now is the Senate is taking up the reconciliation process there, and then they have to begin negotiations with the House if the Senate bill looks different than the House. And we are anticipating that the Senate bill will look different. And then next, the president released his skinny budget on May 2nd. For instance, this includes like the Department of Health and Human Services budget. It designates a reduction of over 26% of funding to that agency. It reflects actions already taken by that agency to reduce the workforce, to do some of that reorganization that we talked about. It also reflects an 18% reduction for the Department of Agriculture. And so we'll have to be watching for the president's budget. And then finally, we are watching the funding freezes. So these are things like cancellation of the LFS program and the LFPA program, about $1 billion that encouraged the local investment in local production of food for schools and for other uses for states. And I know that many nonprofits and other organizations in states are also affected by and watching funding freezes. So I know that was a lot. You will have these slides. I think I see Heidi and Srila nodding. I have about 5 minutes if folks have questions, and I'll also make myself available to all of you.
Thank you, Erica. That was fantastic. And we are happy to collect questions from the chat as well and share those with Erica. But do we have any burning questions and that folks want to ask?
I see Brett asked in the chat if I have the link. They are on the slides, and I can also follow up via email afterwards. And I can put them in the chat right now too.
I guess just to follow up, yeah, thanks for a great overview, Erica. This is Brett Perkison. I just your sort of impression, if there is any kind of reading of the tea leaves, it sounds like that nutrition is still emphasized, and they're taking proposals and considerations. Just sort of what the method is to why some of these social determinants of health are still considered important, why others aren't. If there's any kind of underlying kind of rationale that you've been able to see as to what they feel like is important.
I think that that is the billion-dollar question. I think it's very interesting. Last week, I'll note too that the administration released their MAHA strategy as well. And I think in that too, there was a lot of emphasis on children's health in terms of like the environment, right? And so I think, I mean, I would infer that a lot of the non-medical drivers of health are very important. I just think that nutrition has gotten a lot of attention just given RFK Jr.'s focus on things like additives and things like that initially. And so, you know, I don't think that there is a specific reason why other non-medical drivers of health like shouldn't be a focus or couldn't be a focus, particularly given what was in that MAHA report, right? I think that personally, like in the Medicare proposed rule, it would be a waste of money to get rid of all of the screenings, right, and replace it with something else. But I think that's for a lot of the stakeholders to weigh in on.
Yeah, I added a
Right.
link to the report in the chat as well. Yeah, and I appreciate you saying that. I mean, it is quite startling, right? The stripping of the funding across these various social determinants of health related activities, and definitely the reconciliation bill has a pretty substantial impact as well, because it also, I think, SNAP-Ed bucket is completely eliminated from that particular bill, which funds a lot of the nutrition education component.
Thank you so much for having me. If there's any other questions, feel free to just follow up in an email.
Thank you, Erica, for joining us. We really appreciate it. And if there's additional questions, we're happy to share back with Erica as well. So feel free to hop off. Oh, Daniela had one question. Did you had your hand raised, Daniela?
No, I didn't.
Oh, okay. All right. Thanks, Erica. Thanks for
Thank
joining.
you.
All right. Well, with that, we're moving forward just to take a moment and step back. And we thought it would be important for us to also reinforce that with the Health Equity Collective, we serve as the backbone organization of the Health Equity Collective. And we have no intention of shifting in that space, and no intention of shifting in the work that we all are doing together. Our co-chairs also remain strong in their commitments. We just wanted to share that we have a recognition that this Health Equity Collective came forth because we all wanted to come together to address non-medical drivers of health. Because we realize that that's what it's going to take. We've done a lot together. We know that this is a challenging time. Lots happening and lot coming forth as well. And from a backbone organization perspective, we just wanted to reassure everybody that we remain committed, not just to continue our existing work, but also to foster additional collaboration, convening, communication, whatever it takes for us to move forward together in this space and weather what's coming our way and what's happening, because it is very disconcerting as well in some ways. So just wanted to reassure everyone of that. Heidi, anything you want to share there?
No, just reiterate the importance, even more now than ever, of us coming together and really aligning to serve our community as many of the services that our region depends on are shifting and changing. It's even more important for organizations to be intentional about how to improve access to care and services that are so critical to the health of our community. So thank you all for being here, and thank you all for continuing to push the work forward.
Yeah, and I'll just add that if there are any, if there's any way or any ideas or things that we could do to support everyone, please feel free to reach out, send us a note. One of the ways that as we're, brainstorming with the work groups and the activities in the work groups, we are thinking about what are the conversations that folks want to have and how can we reach out locally, state level, nationally to help facilitate those, and also leverage our academic expertise to help support some of the research evaluation, that sort of work as well, as these changes happen. And Suzanne, has any analysis been done on the potential impact on populations served by these programs? I think in some spaces, yes. There was actually Jamie Olson from Feeding Texas presented a really nice report on the impacts of the potential SNAP bed cuts, as well as the potential cuts around Medicaid, and its impact in Texas. We can, I think we have some of that presentation recorded actually, so we can share that out again as well. Heidi, I think I'll pass it back to you.
Thank you. So moving along, I know we have a number of folks who are new. For many of you, this is just a quick reflection of how we do our work, which I think is an important level setting as we look at the work that's underway. First of all, the work of the Health Equity Collective is very intentionally collective impact. So how do we develop the collaboration where the work that our organization is supporting and moving the work of your organization forward? And in order to achieve that type of collaboration, really it's coming together, developing a common agenda of our shared priorities of how do your priorities align with my priorities? What are those shared common measures? And how do the activities that we do across our organization support each other? That takes communications and ongoing communication, a lot of it, and then the role of the backbone organization, and a lot of gratitude for UT Health for creating this space and allowing us to focus on supporting this coalition and collaborative effort for our region. We've also included our guiding principles, the way we commit to working together, as well as the values, the good things we look to bring into the world. I won't go into the specifics, but wanted to have those to frame the conversations of the work that's underway. All of our work is anchored by our framework. This is the systems that are, and then the work that we do across the work group is focused on these actions of health anchored by community engagement and these 4 buckets of action. So you'll see a lot of alignment in how we do the work in the work groups with those 4 buckets. Quick reflection, we launched in December of 2018, very diverse. You can see the sectors represented not only in that little wheel there, but also as you look around this virtual screen. Our broad systems approach. I think one of the pieces that sets the Health Equity Collective apart is that we are a systems coalition rather than a grassroots coalition. So working at supporting organizations to serve communities. These are the work groups, and the co-chairs of the work groups comprise a steering committee along with Srila and I, the backbone team anchored out of the Center for Health Equity at UT Health. And I will pass it to Srila to talk a little bit more about the center and how the center supports this work.
Sure, and I have the privilege of serving as the director of the Center for Health Equity. It's one of the research centers at UT Health Houston, and I don't think anybody is going to disagree with me when I say that we really cannot conduct any sound research in the space of social or structural determinants of health without really engaging with our broader community and partnering together, right? So that's one of the core reasons why we are supporting and facilitating the work of the Health Equity Collective. It's a core infrastructure effort, which is one of our layers of the work that we do. And we are very, again, privileged to play this role and will continue to remain committed in supporting and facilitating. I think it's important to also say here that the Health Equity Collective is not owned by any organization. We all have shared ownership of the work that happens in the Health Equity Collective, and each of us, whether we're a backbone organization or chairing a work group, our role is to help facilitate and push the work forward. Next slide. Without going into any details ad nauseum, we just wanted to share this with everybody in the spirit of transparency on what is it that the center supports. And the buckets that are in the burnt orange, representing UT colors, we have the work that is primarily supported through the center, which is primarily administrative and operational support. So whether, and a big part of that is communications. We have absolute rock star co-chairs in the Health Equity Collective on the communications work group. But in addition to really amplify the voice, creatively, operationally funding, student power that we can garner, those are sort of the additional functions that we are able to support through the center. And everything that you see in the white boxes are things that all of you are engaged in with the Health Equity Collective. So just wanted to share this out as well. And with that, going back to you, Heidi, I think you're going to take us into the next space.
So we're going to move into the work group updates. Before we do that, just wanted to kind of celebrate a number of our exciting advances. We continue to grow in membership and in followers. And so excited to have new folks, new organizations joining. We are thrilled, the communications team will share a little bit more about this, to roll out a new updated website, which captures the current operations. And then also the long-awaited launch of our care network as we're onboarding users currently. Really powerful Food is Medicine Symposium and survey of the statewide food is medicine landscape underway from the Food Security Work Group. And then also in the Food Security Work Group, we've done a whole qualitative assessment of the impact of stigma as a barrier to food resources. Really important findings there of unpacking the role of stigma as a barrier to services and care, which aligns well with the mental health and substance use work group. More on that to come. Our policy work group co-chairs, Jordan and Iris, shout out to them as well. since the legislative session started. It's over 60 policy related meetings, touch bases, collaborative conversations underway with so much legislative change on the state level. They'll share some highlights on that too. And then just want to extend an invitation to those of you who aren't engaged in the work groups at this yet to join. That's really your opportunity to be a part of making the work happen, to push this agenda forward across the board. So there's a link here which we'll put in the chat, and then also always welcome you to reach out and let us know if you want to get involved in any way. And with that, I'm going to actually pass it to Jordan and Iris to talk about the latest in the policy space.
Thank you, Heidi. Thank you, Lorenzo, and y'all for the love. We can go on to what our work group does. It was, yeah, we were talking, we're like, oh, it was a while ago that we met in person, and we were saying like, and it was before the session, it was before January, I think it was the end of 2024, and we were, you know, using that in-person meeting as a plug to come into the policy folds while we were in session. And um, we didn't do the math on this, we can, but we definitely had a lot of new people join our monthly and weekly meetings. So that was really exciting. But yeah, a lot of what we do is here building policy collaborations, linking people together to support each other's legislative priority, and then trying to educate the broader membership about current legislation going on. Often our focus is on the state level, but there's a lot going on federally, as we just heard from Erica, and we also want to shift some of our focus locally to put pressure on our local decision makers, given the situation we're in federally, and how that's what the session has turned out to, and some of the emboldening because of the current administration. We knew what that would look like in our Texas state level. What would you add, Iris? Sorry.
Oh, yeah, I think there's some connection there too that you'll see and that we'll talk about, of nutrition being a focus versus food security, and what does that look like, to some of the other culture wars. We won't dig too deep into that, but what does it really mean, and what might we see even with schools and kids, and what does that do then ultimately for mental health and safety, that kind of thing. So yes.
We have, and you can go to the next one, Heidi. We have some specific policy priorities. Oh, oops. These are just some, probably missing a few, but member organizations who are part of the SDOH policy work group. So thank you all for all your contributions. It's always like a really dynamic conversation and supportive space as well. But yeah, so we, like Iris was alluding to, we have policy priorities, but we talk about a lot of things, because so many of like what does social determinants of health, that's everything. So we really get into all of that, despite having some specific priority issues as well. But
Yeah, and big shout out to our members. And again, we couldn't do this without the work that a lot of the different members are able to do. So first, on food security, Carolina Cano has been a great member and partner through the Houston Food Bank, working on HB 136. And oh, sorry, not that one. That one, hold on, I'm sorry about that. On HB 26. And this is the Medicaid in lieu of services. This would create and allow a pilot program. So managed care organizations would be allowed to have an in lieu of service for medically tailored meals and nutrition counseling for pregnant women. So this is a huge win. The way that it started out, and if you were a part of our weekly calls, there was some concern that meals would not be included. And thankfully, in the end, with an amendment and a lot of the work, again, going back to credit with Carolina Cano, in being able to add medically tailored meals to that pilot program. And then Alicia Lee with March of Dimes with HB 136. And this bill allows for the reimbursement of lactation consultation services within Medicaid. So this is also something that is a great win. There were some other bills that we'll take a deeper dive on through the policy work group of what might we look at ahead that maybe did not pass this session, but we want to try to put some effort in.
Yeah, so we do our monthly work group meetings if you don't um, by topic. So very, very much open. Like if anyone just is interested in a specific topic, they could come just on that one time. And so continuing along through the months, we had Ken and Rosie with Wild Blue Health Solutions. Shout out to them. They're like the experts when it comes to care and coverage and insurance and a really complicated topic that I think, we heard a little bit from Erica about what's going on with Medicaid and Medicare. And so we talked about what was happening at the state level, but unfortunately not a lot this session. But so we really talked a lot about everything going on federally. And a lot of the time the space is also around brainstorming, like how can we take action either as organizations or collectively. So that is where that conversation went. I'm going to drop this link again that has a lot of resources from Texans Care for Children, but they put everything in one spot around the federal action and what's going on with Medicaid and SNAP cuts. Mental health, Rebecca with Mental Health America of Greater Houston, one of them, our members, came and talked about what was going on in that space. Shout out to all the advocates who pushed for a bill that is being sent to the governor right now. So that's good. It's SB 207. And it essentially allows students excused absences for mental health appointments. So, the mental health work group will talk later, and I know they're doing a lot of work around stigma. And so I feel like this is a good step there with like physical health and mental health. Like a student might need an appointment for a mental health and not just physical. And then Charles with Texas 2036 came in to talk to us about messaging to conservative lawmakers and constituents, which was really, really useful information, especially given all the calls and people were making at the federal level, and then also all the testifying and work that everybody was doing at the state level. And really quick, we hosted about 10-ish weekly touch point calls on Friday afternoon. We have one more this Friday, so come at 2 p.m. if you're interested.
Yeah, so this coming week, we'll be talking about what's left in the session. And so just a little preview, June 2nd is sine die, which means it's the last day of session. Right now, what the legislature is working on is their conference committee reports and finalizing some of those bills, like the budget bill, which is Senate Bill 1. We'll take deeper dives also into that as we move through the session of what's available as far as maybe some grant funding that might be available there. And then also, what does it look like coming in the following months, especially September 1, when a lot of these bills will be effective, and then maybe even January 1st. And so what might we see as far as even like when I mentioned the lactation consultant. So last session we talked about HB 1575 and what does that look like as far as the implementation for HHSC. That will be also very similar for this lactation consultant. It will create the provider and then having to go through the provider enrollment and what are we seeing there. So those will be conversations that will continue as we look forward with the implementation, because it's not just a bill has passed and now all of a sudden it's magic and it's just there. There's a lot of work that goes into what these look like. And we'll also be keeping an eye on some of the other food as medicine bills, for instance, Senate Bill 25 by Colcourse that creates a Texas Nutrition Advisory Committee. And what does that look like? And what does that mean for the information that's shared on this website that will be created? And then also training that will be required in schools all the way from grade school to higher education, and then continuing ed for medical professionals. So yeah, definitely come and join our group. We'd love to have different perspectives and then also different eyes to be able to help with monitoring, because there's a lot to look into, and we value everybody's eyes on it because it's a lot.
There's a couple of questions. One, how do we join the work group?
This work group, you can either DM one of us your email and we'll add you to our list, or our emails will be on the next slide and you can reach out. But that's just generally right, Heidi.
That's for the policy work group. Feel free to reach out to me as well. I'll put my email in the chat. We do have a link for that. If you are new, this is for anybody who's new. I recommend coming to our next new member orientation, where really we talk about the process of getting involved too. But then I'll pass it. Deborah Banerjee has a question on how to track lists of bills. I know y'all have several trackers that you're following, actually.
Well, our partners at Texas RPC, they have an amazing bill tracker, and we can drop that. We have our own less formal methods as well. Also on July 17th, like we have to see like where everything fully lands in the next few days, essentially. And so Wes and Alicia had asked us to come in July for a virtual networking session. So we'll do a recap. We'll probably focus on those priorities that are listed there: food security, mental health, maternal health, and doulas, CHWs, healthcare coverage and access, housing, education, and reproductive healthcare. If anyone has a request though for that, please drop it in the chat and we will give an update on any topic that you're interested in.
And we're recording this deck and these slides, and they'll all go out and have all information and contact. So yeah, please reach out, and we can drop the link to the Texas RPC bill tracker, right, Jordan?
Yes, I will do that in a second.
Yeah, and just for perspective, there were about 8,800 bills that were passed, that along with the joint resolutions. So there is the text legislature online, which can also provide some reports too, but again, that's the sheer number of how many there were that were filed. Passed so far right now are 804. There's been one veto so far too, so that's another thing, is that while some of these have passed, there is opportunity for the governor to veto some of these bills. There's certain timeframes depending on when it's gets to him, but and when it's effective, but likely June 20th will be the last day, if I'm remembering correctly. And then the other point is that there will be these joint resolutions that, if passed fully, will come up on the ballot for vote. So we'll be monitoring those as well, but just to shrink those down to the 800 that were passed, and how many of those would be the ones for us to monitor, and then maybe shift through some of the ones that did not pass that are some high priorities and fit within our policy priorities that we've listed here. It would be helpful if also people were following something and let us know if we're not lifting it up. So definitely thank y'all for that.
Thank y'all. I want to be mindful of all the other work groups.
Can we
But
take this last question and then move on?
yes, and also thank you, Lisa, because Sydney's a really active member of our work group whose weekly legislative updates are incredibly detailed and helpful, especially on the topics of mental health and substance use, but on a lot of other topics as well. Brett asks, any bills regarding the requirement of employers to have heat stress prevention programs or other occupationally related protections for their employees? That's not something we're specifically tracking, but we can definitely look into it. I can ask labor friends. I know that something passed, like they passed that bad bill about that last session. So we'll email you, Brett.
Thank you.
Yes, Ken. All right, thank you so much for very robust updates. Clearly so much happening, and so much that's critical and impacts the work of all of us. So it's really helpful to have insights into what's happening. There's the emails, contact information. We'll pause there for just a moment. And then I'll pass it to our communications work group co-leads, Alicia and Wes. You're up.
Hi, good morning, everyone. My name is Alicia Johnston, and I have the privilege of serving as the communications work group co-lead alongside Wes Gibson. So communications is one of 7 of the Health Equity Collective work groups. It was established in March 2020. And what we do is develop strategies to increase awareness of and engagement in the Health Equity Collective itself, as well as SDOH or non-medical driver of health efforts across our region. What this looks like in 2025, our work group has really been focusing on broadening local, state, and national expert engagement in our work. We're developing shared tools, measurements, and plans, fostering connections between our work groups and external collaborators, and then promoting our successful outcomes and initiatives through tracking. We don't do this work alone. We've had many contributors representing several organizations, which you see on the right center of the slide there. And we want to thank everyone for their dedication and effort over the years. I'll also mention here that we are searching for a new communications co-lead. So if there is anyone interested in this position, you can use that link that was dropped in the chat a few moments ago around expressing interest in the work groups, or contact Heidi, Wes, or myself, and we can help you learn more about that role. So today we will highlight some of our recent wins and then some upcoming events and priorities. So Heidi, if you don't mind going to the next slide. Right, so Heidi mentioned this earlier, but we have updated our website. I'm dropping the link in the chat, or you can use your phone to follow that QR code. This project has been in the works for some time, so really want to give a shout out to Janet Satterwhite with UT Health for all of her support in these efforts to push this project forward. What you'll notice when you visit the site is really a streamlined and crisper messaging with a greater focus on the current phase of the collective, less about who we are and more about what we do, because we are in that action phase of the work. You'll also see more detail around the work groups and then highlighting those key projects. So we do hope that you appreciate the site as much as we do. And if you do have any feedback, please share with Wes and I. Next slide, Heidi. Okay, so many of you are familiar with Mighty Networks. It's been our faithful and true community and networking platform since June 2019. We've made the decision to sunset the platform over the next few weeks as we begin making way for a newer, more agile technology to support our growing membership. So going forward, we will leverage our website more, particularly like the event page, which we've relied heavily on Mighty Networks for that. But now Jana's got us set up with the event section on the new website. We'll also be leveraging our social media channels more, and then we'll soon be rolling out Salesforce to help bring those pieces together, and then also enhance that member journey. We have archived all of the content on Mighty Networks. If anything new does get added, we will be sure to archive that as well. But if there is anything that you wish to capture, someone you wish to connect with through the platform, we do encourage you to do so in the next few weeks. You can follow that QR code there on the slide, and then I'm also going to drop the link in the chat so you can access that content. Next slide, please, Heidi. Great. So many of you participated in our Walk and Learn series. This is something we've been working on since 2023. It's a joint partnership between the Health Equity Collective and Fit Houston. Fit Houston is a local nonprofit that increases physical activity across Houston's communities. If you're not familiar with Fit Houston already, or the work of Larissa Jacobs, check them out. Oh, look at, she's already commenting in the chat. It's just incredible how quickly this group has grown and how they're really inspiring activity far and wide. Their reach is truly incredible in the network they're building, and just seeing the growth of these walk and learns, which you can see in the pictures here, and just how it's evolved since inception. So we've completed 6 walks to date. We have 2 coming up this fall, one in Acres Homes in partnership with the Acres Home Chamber, a farmers market, the Acres Home Community Advisory Group, City of Houston. We're partnering with some Super Neighborhood 6, Be Well Acres Homes, which is an MD Anderson initiative. And then we have a new partner just this week, King's Bikes. That walk is on Saturday, August 2nd, and we'll be sending a save the date as well as some registration details soon. The next walk we have is our 2nd annual Cashmere Garden Walk. This is in partnership with the Cashmere Gardens Northeast Community Farmers Market, Northeast Houston Redevelopment Council, 2 of the super neighborhoods, number 48 and 52, and then Harris Health. We had over 100 people join us last year for this walk, and then the community came back to us wanting to redo it again this year, which we were also very much looking forward to. So we have that one scheduled for Saturday, September 6th, and then the save the date and the registration for that walk will be coming out soon as well. So really the purpose of the Walk and Learn series is to connect our members, our member organizations with the community. We aim to improve health, of course, but we really want to help bridge those connections so we can expand our networks and collectively advance our shared goals. We do have a flyer for the walks that we created. So if you want to learn more about that, I'm dropping that link in the chat here. And again, join us for an upcoming walk as well. So with that, next slide, please, Heidi, and I'll pass it over to Wes.
Oh. Wes, are you there? Uh-oh, did we lose him?
I'm happy to cover.
I see he's here.
Oh,
but
Oh, he keeps getting muted. Alicia, do you wanna?
Too. So, learning and networking sessions. So many of you participated in these sessions. I'm drawing a blank, but Jordan just mentioned it a moment ago about one that's upcoming. So you'll see that on the calendar here on July 17th. We'll have that Texas and federal policy debrief. But we started these networking and learning sessions during the pandemic when we were all sort of locked up and weren't able to really get together and network and learn about each other's work and what was happening in the community. And they've really taken off. We keep seeing really robust engagement. So we've continued those. We host them almost monthly. Generally, they're the third Thursday of the month, 8:30 to 9:30. And it's really around promoting that shared learning environment, incorporating various perspectives. And we've been bringing in more national experts so we can, learn from each other and share about the incredible work that's happening in our community. So if you have ideas for networking session topics, you can see that we have both September and October open. Please share those with us. There are times where we have more than one a month. But if you have any topics or you'd like to share something, please contact Heidi West or myself.
Can you all hear me now?
There you are.
yes.
Okay, great. Well, I'll present this next. Can you just give me temporary, oh, here it is. I'll share my screen. So the last thing we'll show is just how we keep track of engagement. All right. Is the dashboard showing up for you all? Okay,
Yes.
great.
Coming through.
Okay. So as you all know, we have a variety of outputs, and so what we do is we use Microsoft Power BI just to get to visualize it all in one place. I won't go in all the details, but for example, we update these metrics on a quarterly basis, and so we'll look at our LinkedIn posts. And so here, what this does is it shows us the engagement rate of posts that we've put over the past 3 months. So this covers January through March of this year. And I mean, one thing I'll just say is generally events like this or anything that involves people in our collective is going to get the most engagement. We'll also keep track of our followers, how many we've had over the past months, what industries they're coming from, and what location. We also include YouTube views, what's had the most views, impressions, click-through rates. And what we see, of course, is one of ours is our pathways, payment pathways for food as medicine programs that we had with Harvard Chilphy, who was speaking earlier, was one of our highest. And then the networking sessions, which Alicia explained, we keep track of attendance. And this just shows us, overall, of course, they're well attended, but we see, okay, what themes do we see to get a lot of engagement from members? And we use this to inform our strategy, help guide other work groups as they're developing outputs and events, and provide logistical support. But this is a way to really archive it and give us a data-driven approach to our communication strategy. And I'll give it back to you all.
Can I just add one thing? I just want to, underscore how fantastic it's been to have all of this communication come out, and especially like, for example, with the networking sessions, there have been so many, we brought in speakers, or Alicia and Wes have facilitated a lot of speakers nationally, and that has led to additional collaborations in these critical spaces, and garnered additional funding for our region, things like that. So I just want to emphasize that this is a way for us to learn, but it's also a way for us to collaborate beyond Texas as well. So just want to underscore and emphasize that, and incredible job by our co-chairs.
Yeah, totally agree. It's a fabulous combination of, the networking session bringing in national leaders, and then things like the community walks of connecting to community members, grassroots communities in neighborhoods across our region. Let me reshare my screen and we'll continue on. Great work, Alicia and Wes. And I'll pass it to William and team.
Hello, good morning, everyone. I'm William Lyons, one of the co-chairs for our Community Voice Work Group. I did want to first celebrate two new co-chairs. We have Kyle with the Harris Health System and then Sandy Martinez with San Jose Clinic. They have been just great to have in collaboration on our efforts. And I'm looking forward to showcasing what we've accomplished thus far in 2025. So a big part of what we've been working on has been on networking, right? So there's so many organizations in our region all kind of focused or mindful about health equity. Um, and there's some people who are mindful about equity in general. And so really trying to tap into that knowledge. So one thing that we've worked towards has been a learning collaborative with an organization of community of practice for community engagement professionals. So really just networking with them and hopefully planning some collaborative events in the fall, and then who knows what's going to happen in 2026. The other thing that we've been supporting is a community advisory group for the closed loop referrals. So there was a group of women who were advising a food as medicine project, and they were able to I guess be repurposed for the closed loop referral process. So really getting their insight to how does this work need to happen to be mindful about the needs of the community. And so what we know, the initial group is really focused, given that the initial group is mostly mothers with children, obviously, and yet in the other iterations of it, we hope to diversify the makeup of the work, the advisory group to be more comprehensive and reflective of our landscape here in the Houston area. We're also hoping to develop materials, so materials to share amongst all of us as part of the organization so that we can learn, grow, and be better at incorporating community and voice or community perspectives into our work. We continue to look to find models that really reflect good quality community engagement and community engagement approaches. And so we have human-centered design, which we saw there was a networking session earlier this year in January, highlighting that. The other ones are trauma-informed community building and then community engagement studio 2.0. Looking ahead, we want to showcase the work that was done in 2023. I think that's when that 2023. So what we're calling is return the results from the DASH grant that that was completed in 2023. So really taking the work back to the community and getting insight to, is this what we heard correctly? And so to do that, though, we realized that we haven't really socialized a health equity collective for the community-based perspective. So we've been working on developing one-pagers and really thinking about how do we translate this work that's very clinic and academia kind of focused, policymakers, advocates to your average Houstonian in our region who also might have a passion for it, but needs something more accessible to them. And then lastly, we're hoping to continue to highlight organizational efforts. So we do plan to survey you all about what you're currently doing related to community of voice and brainstorm what are some best practices in our region that we can showcase and highlight. and then also have a panel discussion of our leaders in our region who are doing this every day in a great way. Next slide. So these are our current priorities. So really trying to cultivate shared learning and implementing strategies, really engaging community members to help diversify our work group and develop toolkits that help us take action, and definitely continue to get inputs to the closed loop referral process. We too are seeking new members. So if you are interested in community voice and engagement, please reach out to us. We typically meet the third Wednesday of the month. Our meetings typically are from 10 to 11:30. As you can see in the bottom picture, we like being outside. We like a good coffee shop. We might have to transition inside in the coming summer heat, but hopefully once things settle down, we can go back outside. And I think that's it for me. Any questions? Any questions in the chat?
Thank you, William. I'm not seeing questions, but definitely appreciate your leadership and bringing us together in person to have some of these really deep, sometimes philosophical conversations about engaging community and systems change work. Really appreciate it.
I love that idea, William, about just doing an assessment about what's going on in, in the community and what folks are doing. And I wonder if this could be some sort of like live document or something so that we know what's happening in vivo in, in action, right? So that we can identify various pathways for partnership and collaboration with each other. That's fantastic work. Thank you for sharing that. I'm not on video. Thank you for sharing that.
Thank you. Yeah, I love the idea of being able to showcase more of what's happening boots on the ground. I know Linda, who's part of our work group, she shared a documentary that will be showcased next week. And so I'm hoping with the new website, that's not new website, the website's already there, but with the sunsetting of the Mighty Networks, we can get more engagement on the website in that networking space where we can kind of showcase things going on in our region.
Absolutely. Absolutely. I think when we do evaluation, we are always like, it's always in the past, right? And then reporting on what's been, assessed in the past 6 months, 12 months, etc. So to know what's actually going on, like that's huge. I think that's a different way to do assessments.
Absolutely.
Yeah.
Thank you, William.
Thank you.
All right, I will pass it to Maria and Melanie for the food security work group updates.
Thanks, Heidi. Hi, everybody. My name is Maria Del Cruz. I'm with Harris Health, and I have the opportunity to co-chair the food security work group with Melanie McGuire from the Houston Food Bank. The food security work group is made of over 36 organizations. So thank you for everyone that joins in on our meetings, participates. And if you're like everyone else interested in joining, please email Heidi. And she's dropped her email in the chat a few times, and she'll connect you to us. Next slide. So back earlier this year, the work group came together and we're like, what do we want to focus on in this upcoming 2025? What are our goals? And what we decided is that we wanted to increase food as medicine programming in the greater Houston region, understand the impact of stigma in the area of food security, and increase organizational capacity to screen and address food insecurity. And we decided this was a lot of work, and the best way to do it is by splitting it up and creating these subgroups. And each of our subgroups are co-led. So I want to do special thank out to all of our co-leads and leads of each of the subgroups. So Dr. Nipa Kamdar is the lead for Stigma, and we are actively looking to recruit a co-lead if anyone's interested. And I'm going to talk a little bit more about what each group is doing in the next slide. Felicia Coleman with Urban Harvest and Jasmine Launer with Houston Food Bank are co-leading our learning series. And then Naomi Tice with the Center for Health Equity and Cassidy Penn with Texas Children Health Plan co-lead the Food as Medicine Program Index. And so each of the subgroups, next slide, is really focusing or aiming to do different things. So our Stigma and Food Insecurity group look to work together to collect, disseminate, and provide advice on what does stigma and food insecurity look like in our region, and what are some of those best practice and those informative and evidence-based resources and strategies that can support our organizations and providing support to both our patients and our clients and our neighbors, as well as our team members and the providers that are supporting individuals with food insecurity. This year, we had the opportunity to conduct interviews with pantry staff and neighbors. We also have some insights on other settings to understand stigma. And Dr. Sharma will be presenting soon on some of the work that has been done in that area. Thank you, Dr. Sharma. In our learning series, this group has been since the food security work group was established. One of the things that we heard over and over from the organizations in the food security group is they wanted to learn more about what other organizations were doing, what were their best practices, how were they doing it, and what were their lessons learned. And we do these through our learning series. And I want to special shout out to both our co-leads that manage the support, but Wes and Alicia with the communications work group that really help us in promoting the work that we do. And so this recent year, earlier this year, and you saw in Wes's slide, one of the largest number of participants participated in the food security context in Greater Houston at the level of implementation, research, and policy. We had presentations from the Houston Food Bank, as well as researcher from the VA that provided insight on what does food security look like in Houston? What does it look like for a specific population with veterans? And then what's happening in the policy context? And in our Food as Medicine Landscape group, we are working to systematically capture the different food and medicine programs across the Greater Houston region. We have done this and special shout out to Naomi and Cassidy, who led a survey to try to understand what are all the different food as medicine organizations in Houston and then the Houston region. Earlier this year, or in April, we were able to bring together some of those organizations that are doing food as medicine in the region, and they all presented out at the Houston Food Bank. That was earlier in April 2025. And then you'll see soon that Naomi's going to be presenting out on the research next month. So if you want to join that. In our recent meetings, as you heard through the policy group, thank you, Iris and Jordan, for all the work that you help, all the resources and information you provide our group. And special shout out to Jamie Olson with Feeding Texas, who has presented out at the last two work group meetings on what's going on in the state and federal government around SNAP and Medicaid. And really that's with so many changes, that's kind of been our focus recently, is just trying to understand what is happening and what are the implications of all of these changes in Texas specifically. So thank you, Jamie Olson with Feeding Texas, for providing that insight for our work group. Melanie is not on, but Heidi and Dr. Sharma, do you have any additions to the work that's happening over here?
I just want to say it's been fantastic. We had a phenomenal turnout at the mini summit, and we hope that that's the first of one we have every year, at least, to learn more about food as medicine and how do we accelerate this work. So would love for folks to join in. And I do want to also underscore about the Food as Medicine landscape scan, because we'll be releasing the results soon, as Maria shared. But this will be sort of the first time that we'll have sightlines to the best that we can, because it is based on people wanting to contribute on what is happening in the state in Food as Medicine, what types of programs are being implemented, and how are they being sustained, how are they funded, what is the evaluation around it. So it's a pretty robust, and we'll have an interactive dashboard on the Center for Health Equity website that will allow folks to play around in regards to the data. And the data will also be available if someone wants to analyze it further. So we want this to be an ongoing landscape scan where folks can add in data, because I think in the end, this will allow all of us to learn about what's happening, use this information in whatever spaces we need to, and identify gaps as well. So we just wanted to chime in there. So thank you, Maria and Melanie.
Yes, thank you, Maria, Melanie, all the co-chairs, all the work group members. For those of you who are not involved in the food security efforts, I also wanted to underscore that the work that is happening within this group and network of folks is really cutting edge nationally and helping to push forward work on food as medicine and how do we develop the systems to be effective in that space. And so it's really exciting to see this moving forward in our region. And many of you have heard me say this before, but I feel really passionate about Houston having the torch and the opportunity to demonstrate how to be effective in these spaces in conservative states. We see these things working in less conservative places, but it's really a challenge in conservative states. And to me, all the work that y'all are accomplishing is just phenomenal and such a bright spot in serving our communities. So thank you. Oh.
No, it's cool. And as I mentioned, if you want to learn more about the Food as Medicine landscape, the QR code leads to registration to our June 27th meeting at 10 a.m. Where Naomi will presenting on the data.
Fantastic. Thank you, Maria.
Yeah.
Great job, guys.
Thank you. And then I'll pass it to Dr. Williams and Lisa.
All righty. Thank you, everyone. It's just some amazing updates. I'm loving to hear all of the different groups and what everyone's doing. Everyone's just doing such great work. I'm Lisa Albert, and I have the privilege of co-chairing with Dr. Stanley Williams, who is not only a wealth of information, but a pillar in our community in regards to behavioral health. And we've been working with this work group and doing several things. So we're going to share them with you. Three of our focuses that we have in this work group is developing a stigma reduction toolkit. And we will be working to develop that based on some of the information that we received from our regional stigma reduction survey. So many of you participated in that. We're going to go ahead and go over the results of that as well. One of the reasons we wanted to do this survey is to understand, the current efforts that organizations are providing in reducing stigma, and if they are providing anything to their employees regarding stigma and reduction of stigma. It's been really exciting because we received 76 surveys that were completed. We conducted an analysis, and we'll go ahead and share that with you, as well as some recommendations. And so from that, we're developing our toolkit. We want to make something available that's easily accessible, easily worked with, so that when people go in, it's it's not just a list of items that they can check. It's going to be something that is really going to be user friendly and easy for them. So our subcommittee working on that has been absolutely fantastic in getting some dates together so that we could begin working on that, and we will be continuing to work on putting that next date together, where we will be meeting and really determining what we're going to create. Is this going to be a website? Is it going to be something else? It's going to be a standalone website? Is it going to be something that's connected to something else? And what is going to be the best option? So we've got lots of work to do in that area. And then the other focus is our mental health and substance use efforts learning series, where we want to highlight different member organizations, some work that's going on in the region, raising awareness of resources, substance use and stigma reduction. We're also looking at bringing in some outside speakers. So based on what we've learned from our surveys, we're going to have some different people come in, mental health and stigma reduction expert, which that date will be sent out to everyone soon, as well as a national expert that will be coming this fall, talking about substance use stigma. So I'm going to hand it over to Dr. Williams for the next couple slides.
Yes, good morning. Just want to thank our work group for all of the thoughtful discussions around stigma. And when you think about stigma, it conjures up a lot of thoughts in your mind about what is stigma, what is the impact. There's a lot of perspectives. You can look at it from the lived experience of the person with mental illness or substance use. You can look at it from the perspective of the provider in the community, engaging a person with mental illness and substance use. So I'm going to talk a little bit about the why of this, defining the stigma, but also I want to talk a little bit about the case for even looking at stigma, because oftentimes when we look at these initiatives, we have to tie it to how it impacts our service delivery, as far as the staff actually providing in the healthcare industry, trying to engage people with mental illness. And so some of the data shows that, like for instance, 1 in 5 adults experience mental illness or substance use, but only half of the people receive treatment. And the reason being is because of stigma. 90% of people with mental illness or substance use challenges say stigma and discrimination impacts their lived experiences, from employment to relationships with their family, being able to get housing and so forth. And then you have this part of the survey that was done by some researchers. Said a survey of US adults found that 48% were unwilling or unsure about working closely with someone who has a serious mental illness or substance use issue. If you look at for youth and adolescents, stigma is a leading cause for them to not even get treatment. Roughly 60% of teens with depression don't get treatment because of this. And then you look at how we're impacted in the community, where 70% of the news stories involving mental illness and substance use are linked to violence and other kind of destructive patterns of behavior in terms of engaging law enforcement and crimes. But the data doesn't show that most of the crimes are committed by people with mental illness. And so stigma is a big issue. And so we have to begin to look at it in terms of being a provider, both in health and in mental health settings. And so when you look at the experts of Link and Phelan, they define a process of this co-occurrence of factors that impact people with mental illness. And so if you look at sort of this 1, 2, 3, 4, it kind of really talks about this this process of people being labeled as part of being different, the stereotyping of differences, separating those from us and them in terms of othering. And then from all of that, people get sort of that loss of status and discrimination. And so I've seen other literature that says that stigma for folks with mental illness and substance use is really a mark of shame, you know. So it's this mark of disgrace that really impacts them in terms of how they view the world, how they engage people, how they even try to get employment and some of those things like that. And so this is very debilitating, you know, for providers, both in health and mental health, to be able to engage a population that is struggling with their own internal processes of stigma. And then also from the provider perspective in terms of their thinking about this population. If you can go to the next slide. So if you look at this slide, it's kind of busy, you know, but when you think about some of the dynamics that are happening with stigma, I mentioned about the labeling, the stereotyping, the discrimination. And then when you look at it, it's like if you're othering people, seeing them almost less than human or not on the same level as you, then you're talking about a power differential. And that power differential can impact how you deliver care based on how you see the individual. And so that's one of the reasons why we really wanted to move toward trying to look at it from the perspective of the provider. We can go to the next slide. And so that's one of the reasons why we went for this this survey. You know, we wanted to look at kind of the landscape about what is actually happening out there in terms of what's available in terms of training and tools. We looked at the different goals of the prevalence and forms of stigma, trying to assess, you know, what is happening in the different organizations, want to evaluate the effectiveness of those different tools, and kind of document the workforce roles and participating in stigma reduction efforts. So this is, you know, real challenging when you think about it, because, you know, we did the survey and we got very good responses from that. And so it begins to look at what are we going to do from there, you know? And so we want to be able to do that. We'll talk about it a little bit later in terms of the toolkits and some of those things we came with that, the training, and being able to look at the different professionals in terms of what they need related to their engagement with people regarding stigma reduction. So we can go to the next slide.
All righty. So in interest of time, I'm just going to go ahead and go through these and give you just a quick rundown. So one of the questions was recognizing stigma within your organization's service delivery. And the results clearly show that there was some lack of clarity. And we saw that within some of the responses that some were unsure, some were even unsure of what stigma was. And so recognizing that there is some need for some education as well. Does your organization currently have stigma reduction efforts in our area? And the results show that there is, again, a need for improved understanding of stigma. We think we've come so far, and I think that we have come far, but we still have a long way to go in relation to understanding stigma. And okay, and then the next one, if they answered yes to question 2, what type of stigma reduction efforts were currently underway? And what we found was that there was a wide variance of different approaches that seemed to underscore the lack of a common definition of stigma. Again, what is it? For example, DEI, employee assistance programs, suicide awareness, CHW trainings. So there was really, even in the response to our questions, it also demonstrated that lack of understanding what it is and what is available out there. The next one is, what are your organization's annual time requirements for stigma reduction training activities? And so what we found there was you know, some indicated that there was, the majority indicated less than an hour was required for time on these activities. 29% were unsure, or, you know, time was related to trainings not specific to stigma, or they didn't have stigma training requirements. And then 37% indicated that there were no offerings. 25% were unsure. 7 said yes for all activities. So there still is, again, lots to be done in this area. Okay, what staff and provider types are involved in stigma reduction activities? And so, you know, we had them select all that pertain to them. And what we see is that community health workers and social workers are involved in the stigma reduction activities. Some of the mental health providers, nurses, some physicians. You know, 10% reported that the front desk staff and pharmacists were engaged within their organizations. And another percentage felt that all staff, all personnel, health education specialists within their organizations were really those that were involved in the stigma reduction activities. So it really varies within organizations on who's involved and who's responsible for it. And that sometimes I think can create that that disconnect with what's going on within the organizations. Okay, next one. On a scale of 1 to 5, how satisfied are you with the organization's stigma reduction efforts? And 27% were neither satisfied nor dissatisfied. They were just sort of content with what was going on. 25%, which is a quarter of our respondents, were very dissatisfied. And then again, another 20 were, so 25 were very dissatisfied, 20% were very satisfied. 18% were dissatisfied. So if you look at the 18%, the 25%, and then just sort of that middle of the road, that's a huge number that are either don't care, they're not really sure, or they're dissatisfied. And then, you know, about 30% felt that they were satisfied or very satisfied. So again, varied responses. Which is not surprising given the you know, variety of organizations that we polled, in addition to their approaches and missions. And I'm going to let Dr. Williams sum up.
Yes, there was a question there. Do you think the organizations might be involved in stigma reduction activities, but not really know it? And that was part of our discussion that we had about having kind of this common language and understanding about stigma, and from what perspective is the training for stigma. And so I think, so that's one of the reasons why we wanted to look at, you know, what is stigma, part of our education with the community, the toolkit, looking at learning opportunities and programs, looking at experts coming in to help educate us, trying to build collaborations and reduction approaches across different conditions. We talked about it on the periphery with the food security work group about stigma reduction research. I know I think I had shared that in the mental health population, a large percentage of folks were going into the emergency room because they didn't have access to food. And they actually were eating in the hospitals and so forth. And so there is a correlation there. I think the biggest thing is that when you look at healthcare providers, sometimes there's this implicit bias, you know, just this unconscious attitude toward understanding about stigma. I think the survey kind of brought some of those out, where folks knew something is wrong, but they were dissatisfied as far as trying to pinpoint what is happening with the engagement. You know, some of us in the healthcare field know that outside of you know, working with patients, you may hear staff comment about certain patients and so forth with mental illness. So it's very challenging, I think, And I think the more that we can educate people about what's happening with their own processes. When I mentioned that 70% of the news stories have negative attitudes toward folks with mental illness and substance use. So we're pressed on all sides. So I think that coming together to talk about it within this health equity coalition may help us to point our true north about what we need to do in terms of engaging this population. So I don't know, Heidi or Lisa, if y'all want to add to that, or if anybody have any questions other than the one I
You know,
see
I
here.
think that just the last thing is that if anyone else would like to participate within this committee, as well as the subgroup working on the toolkit, any information that you may have is going to be useful, including if you are savvy with, developing websites, and maybe able to provide some information back on what might be some good approaches. If you have familiarity in those areas, it would be helpful. So reach out to Heidi and she'll connect you with us.
Yeah, I want to talk, Brett had a very good point about the co-pays and being able to pay for your care and so forth. And, if you look at, there isn't the parity that we thought was going to be with health and mental health that would have helped if we would have said, there's no health without mental health. So that's a problem there. And then the other thing is a lot of our population with mental health don't have, they have challenges with employment, their own insurance coverage, and so forth. And so you may begin to associate people with mental illness as having something innately wrong with them, that they can't even get care. And so I think all of those are those emotions that are connected with that we would want to bring to the forefront and be transparent. I think the more that we're honest about this as providers, and create a safe space for clients to get care, I think it's going to improve our outcomes and quality of care.
Thank you, Dr. Williams. Lots of good policy work there, Lisa. Thank you to NVHP's leadership in that space, and also the Harris Center team too. There's a lot of good policy work underway. I'm going to move us along because we've got some more updates, and we're and only a few more minutes of time. We're going to talk about the closed loop referral. Sheila, I'll pass it to you to get us started.
Sure. Do you want to just go ahead and click the
Yes,
slide?
click all the way through.
Yeah, I think I don't want to belabor on the slide too much, but just essentially highlighting that clearly there's a lot of work going on, and we've been embarking on this project of really how do we leverage existing technologies to build better connectivity for care coordination. And so this is something we've been working on for a little while now. I think many of you who've been with us have seen updates, and so we wanted to take a few minutes to give additional updates on where things are. And I think one of the couple of main points I want to underscore, one is that we are working with Health Connect Texas. The prior name was Greater Houston Health Connect, which is our health information exchange, and they have a master patient index of over 24 million. And so we wanted to leverage that particular technology asset that most of our health systems are already participating in, and build out this closed loop referral capacity. And so next slide. To that end, I know this is a little gray and hard to see, but this is our care network dashboard. So it's the Health Equity Collective Community Assistance and Referral Exchange network that is building out this connectivity, leveraging the health information exchange. You'll see in the next slide, but and maybe we can do that and come back to this, Heidi, because it might be easier for folks to understand. We have our health system organizations that you see on the left, that we are doing a very concerted demonstration project in partnership with the Houston Food Bank, that is also serving as the hub, not just for food, but also connecting to other social services in our region. And we've leveraged their resource directory to build out this connectivity. And what you see in the previous slide was actually, if you want to go back, Heidi, to the previous slide. What you see here is actually what the dashboard looks like for someone who's, say, a case manager at Memorial Hermann, who wants to do a referral to the Houston Food Bank. So there's screening, and then there is referral, and both sides get to see the referral, and then also whether the referral is closed or how is it being resolved. So we are in the thick of it, and there's a lot that we have done. I think we have one slide that articulates all of the different progress that we have achieved. We are definitely very much squarely into the last 3 buckets here of building testing. The project is squarely underway. We are onboarding. We've developed a lot of onboarding training and implementation toolkits, mapping out. We've completed mapping out of the workflows, and we're bringing on organization. We're staggering them on as we speak. So anything you want to add here, Heidi?
Yes, I want to kind of address Donna's question there. A lot of what we're doing in the demonstration project, it's the development of the process. And then the demonstration project will be looking later this year to what are the processes for bringing more organizations on. For the demonstration project, we've really been working over the past couple of years on this curated group of organizations that raised their hand and wanted to be a part of building out this capacity and infrastructure for our region. At every level, there has been so much learning because the way we've structured this project, it is distinct from, say, like the Unite Us and the Find Help platforms that are just all contained. This is actually taking organizational operations and linking them, and that interoperability. So it takes more time on the front end, but is really looking at how do we better work together rather than creating redundant silos. So Donna, great question, and more coming soon as we look to the fall on what some of those steps might be.
Yeah, and there's a lot of to underscore the learning. I think one of our outputs in this is how do we onboard additional organizations as we move into the fall. And that's part of our onboarding work, that toolkit that we're building out. But another part is that we'll have a robust evaluation plan and metrics of success. I think the part here that I want to highlight is that we're building out a dashboard. At the Center for Health Equity, we actually have a data visualization studio. And so we'll be leveraging that along with the dashboard work that is being, I think you'd have next slide outline some of the evaluation. But the dashboard will build transparency in terms of what does our screening, referral resolution, all of those metrics look like. So that's going to be an important asset for organizations and us as a region as well. So those are some other pieces that we're working on from an evaluation perspective, because just because you have a technology doesn't mean it will be used or adopted or create efficiencies. And so those are some of the pieces we'll be assessing.
Critical components. Another piece, and we just have a couple minutes to do this, is that's the tool and the technology. We know that there's workforces and humans to do that. And one of the key workforces that we've spent a lot of time supporting is this community health worker effort. And I'll pass it to you, Rosalia, to just cover the work that's underway there for a couple of minutes.
Sure, of course. Thank you and welcome everybody. This has been a great benefit to listen to all the updates. And of course, I want to be on all the work groups. and every time someone spoke, I'm like, that would be a great speaker for our Community Health Worker Association network. So don't be surprised if you get an email from me, because always looking for ways to engage community health workers in this conversation and opportunities. And what we're showing right now, this is kind of our grounding document on as we try to build supports and just a very vibrant ecosystem for community health workers, how we're including them and supporting them. This is actually a video. If you have not seen it, I won't go through the whole infographic, but it is available on YouTube for those that haven't seen it. Some of the activities we've been doing is going back to our early adopter learning cohort, which was basically bringing together community health worker employers and allies, and focusing on what we can do to make to improve our systems at a system base, how we can support community health workers. With all collaboratives, it's always about growing and changing. So we're looking forward to building out a community of practice where we can continue developing ideas, toolkits, resources, anything that will help employers, because we're looking at employers as allies and working with them to have, because they want to provide a good service to the community that's efficient and effective. So this is, we're having conversations around that. The big policy change, not a lot to report for this session, because last session and the 88th session, there were actually 2 community health worker bills that passed for like the first time ever, that had to do with financial sustainability. So we've really needed like all this time, because that's where the work starts, with the policy. So how is it implemented? So we're trying to keep track of all that and insert ourselves, insert ourselves into the conversation. So again, we can support community health workers, make sure it's working for them. So we'll continue doing that, and we're already looking towards the 90th legislative session. That's going to be our year. And again, anyone who wants to engage with community health workers, allies, any work that we're doing, we invite you to the Community Health Worker Network. It's a meeting once a month where we bring in news from the world and locally and from other parts of HEC, and really try to engage with our community health worker allies out in the region. Everyone is invited. If you want to contribute, share, learn, everyone is invited to that. And there are resources and other informations on the HEC website. And I think there's.
Thank you, Rosalia.
Okay, that's it.
I think we can end there. We've hit our time. Really appreciate everybody, your contributions, being here. Look forward to future engagements and next steps across all these different work groups, and hope to see you in the work groups.
Thank you all.
Thank you.
1 minute over.